These are not clearly plans that you enact under normal circumstances, but of course these are far from normal circumstances.
Quebec has put together a contingency plan to keep hospitals operating if the current Omicron surge overwhelms the hospital network. What they say is a harm reduction approach taken to COVID-19. Over 3,400 patients are in hospital Wednesday due to the virus. The hospital plan focuses on 4 aspects: accepting the risk of the virus, reduce patient admissions and shorten hospital stays, hospital support or at-home care by family members or caregivers, and if those efforts aren't enough to improve capacity, the final part of the plan is redefining the minimum quality of care.
I think it's a plan born out of necessity. I think under the circumstances, given the current realities, I think it's a relatively well laid out approach. How much of a difference it's going to make, I mean, COVID-19 has done this to us repeatedly. We want to tell it what to do, and it decides it has other plans.
Part of that plan that really has me preoccupied is the fact that, they're asking family members to now assume a lot of the caregiving for sick patients. And I think that's shifting the burden of medical care from healthcare professionals that are trained to do that work and are in the appropriate setting with the appropriate tools to do that work to family members who do not necessarily have the training. They certainly don't have the patient-proof homes in which to care for loved ones.
Family members of patients would be asked to provide basic care for their relatives so healthcare workers could focus on clinical tasks. Jimmy Chan was at the Jewish General Hospital with his father when we spoke to him about the plan. His father was rushed to the emergency on January 1st with a high fever. Chan says he's received excellent care from the doctors and nurses, but if he'd have to care for his dad himself, he could step in some way to help, but there are other challenges.
My father all my life, so it won't come to me than anybody else. But then I have to work.
The last part of Quebec's contingency plan, redefining the minimum quality of care, was explained as providing B-level care instead of A-plus care to patients in order to treat more people.
I think that itself, such a statement and such kind of thinking is really a true declaration that our healthcare system has collapsed. And it hasn't collapsed because of the COVID pandemic. I think it collapsed a long time ago.
At the end of the day, you've got to do what you've got to do. And of course, it's always easier to tackle the problem that is right in front of you. But that certainly does come, I think, at a very real cost. And I don't think we've really wrapped our heads around how much of a cost this has already incurred, how much more of a cost is going to be before we're through Omicron, and how we're going to deal with that cost.
In Montreal, Pamela Pagano, City News.